A recent survey revealed that the majority of physicians and therapists view telehealth as a better way to practice medicine. Now, joining us to share more about the findings is Chief Medical Officer at SteadyMD, Dr. Josh Imdur. Thank you for joining us, Doctor. How are you?
I'm doing really well, James. Thanks for having me on this morning.
Well, I appreciate it. So, discuss for us the findings from the recent survey.
Yeah, so my company, SteadyMD, hires nurses, doctors, and therapists to power telehealth for many large companies. Over the course of the pandemic, we surveyed close to 2,000 applicants, and we found that there was just a huge demand for doctors, nurses, and therapists who wanted to practice in a new way. And our study showed that 64% of these clinicians were interested in working nights, and 85% were interested and open to working on weekends. Also, when asked if they wanted to work full time, 65% of them said they did. So to me, that really showed that we know we have a clinician shortage, and there's a lot of clinicians out there who really want to practice in a different way.
Now, what does this all mean for our viewers as it pertains to the future of medicine?
Yeah, so it means a number of things. I mean, like I said, the data suggests that our doctors, nurses, and therapists are interested in practicing via digital health. And it also means that patients are looking to connect with their doctors and healthcare professionals online. During COVID, we saw more than a 20-time uptake in the utilization of telehealth. So I think there's a really strong future ahead of us.
Now, what are some of the many benefits of telehealth?
So number one is convenience. I mean, from a patient perspective, we've all been there with our kids or ourselves where we just haven't had time to get in to talk to our doctor. And now with the ubiquity of cell phones, people can just open up an app and connect with a trusted healthcare professional. From the doctor and nurse and therapist side of things, it also can really streamline care. There's some things that we can take care of in just minutes. It can be a chat-based visit, it could be a phone call, it could be a video call, and that really frees up time in my busy office and also in our busy emergency rooms and hospitals to get patients to the care they need at the right place at the right time.
Not only that, as someone who has taken somebody to the hospital, sitting in the waiting room is something else too.
Yeah, and that really speaks to the fact that I think we're all looking for something different that skips the waiting room. And with COVID, we learned that waiting rooms were full of virus, and being able to connect virtually during a pandemic was really a huge win for all of us.
Now, are there any potential drawbacks or instances where in-person medicine might be more advantageous?
Absolutely. Like telehealth is not a one-size-fits-all solution, but it is such an important tool to direct patients so they can get the care they need at the right place and the right time. There's multiple diagnoses that we can care for very safely and effectively, if not even better than in person via remote care, like caring for chronic conditions, things that just require lab follow-up. We can manage those things very, very well remotely. But, if you need a surgery, you need a procedure or some life-saving modality, the hospital is still the place to go.
Yeah, it definitely is. I was just thinking about that. Imagining, do I do a telephone call with my physician, or is it the situation where it's 911 and I need to get to the hospital immediately? How do you determine that? How does that patient say, what am I going to do here?
Sometimes it's a very hard decision to make, and that's where the convenience of telehealth is fantastic, because it allows patients to get that advice. I mean, some things, if you're having chest pain, you're having trouble breathing, someone's unconscious, like absolutely, like that's a life or limb threatening emergency. But other times where you're just not quite sure if you can connect with a healthcare professional within seconds to minutes, getting that level of expertise is very beneficial.
Now, doctor, where can our viewers go for more information?
Yeah, so you can visit us at SteadyMD.com and learn more about our St. Louis-based company.
Been talking with Chief Medical Officer at SteadyMD, Dr. Josh Emdor. Thank you so much for joining us on Morning Blend.
Thanks so much, James.